Question 1. A newly licensed nurse is preparing to administer medications to 4 clients on a busy medical surgical unit. During report, the nurse learns that one client has a blood pressure of 88/52 mmHg and is scheduled to receive an antihypertensive medication. Another client has a blood glucose level of 310 mg per deciliter and is due for scheduled insulin. A third client is scheduled for a routine stool softener and has stable vital signs. A fourth client is requesting a PRN sleep medication. The nurse remembers that NCLEX questions frequently test the concept of withholding medications when assessment findings indicate potential harm. Which action is most appropriate? A. Administer the antihypertensive medication as prescribed because it was ordered by the provider. B. Hold the antihypertensive medication and assess the client before administration. C. Administer all medications as scheduled to avoid delaying treatment. D. Give the sleep medication first because the client requested it. Answer. B. Hold the antihypertensive medication and assess the client before administration. Rationale. One of the most common NCLEX traps is blindly following an order without reassessing the client. Hypotension may make antihypertensive administration unsafe. Question 2. A nurse is caring for a client admitted with acute shortness of breath. The client suddenly develops oxygen saturation of 84%, respiratory rate of 34 per minute, and severe dyspnea. The nurse knows the provider is expected to arrive within 5 minutes. What is the nurse's priority action? A. Wait for the provider before intervening. B. Review the client's laboratory results. C. Apply oxygen and assess airway and breathing. D. Document the change in condition. Answer. C. Apply oxygen and assess airway and breathing. Rationale. A classic NCLEX trap is choosing provider notification before implementing immediate nursing interventions. Question 3. A postoperative client reports incisional pain rated 8 out of 10. The nurse notes that the client received morphine 15 minutes ago. What should the nurse do first? A. Notify the provider immediately. B. Reassess pain and evaluate medication effectiveness. C. Administer another dose of morphine. D. Document that the medication was ineffective. Answer. B. Reassess pain and evaluate medication effectiveness. Rationale. NCLEX frequently tests assessment before action. Additional medication may not yet be indicated. Question 4. A nurse receives a prescription to administer potassium chloride for push to correct hypokalemia. Which action is appropriate? A. Administer as prescribed. B. Clarify the prescription before administration. C. Dilute the medication and administer slowly for push. D. Ask another nurse to verify the dose and proceed. Answer. B. Clarify the prescription before administration. Rationale. Potassium chloride is never administered for push. This is a major NCLEX safety trap. Question 5. A client with heart failure develops sudden crackles, dyspnea, and oxygen saturation of 86%. Which prescription should the nurse implement first? A. Daily weight. B. Sodium-restricted diet education. C. Apply oxygen. D. Schedule physical therapy. Answer. C. Apply oxygen. Rationale. NCLEX often places airway and oxygenation interventions among less urgent options. Question 6. A nurse enters a client's room and finds the client lying on the floor beside the bed. What should the nurse do first? A. Assist the client back into bed. B. Complete an incident report. C. Assess the client for injuries. D. Notify the provider. Answer. C. Assess the client for injuries. Rationale. Assessment comes before reporting, documentation, or repositioning. Question 7. A nurse is caring for 4 clients. Which client should be assessed first? A. Client with chronic arthritis pain rated 5 out of 10. B. Client requesting discharge instructions. C. Client with sudden confusion and restlessness. D. Client waiting for scheduled dressing change. Answer. C. Client with sudden confusion and restlessness. Rationale. Acute mental status changes may indicate hypoxia or neurological compromise. Question 8. A client receiving blood transfusion develops chills, fever, and back pain after 15 minutes. What should the nurse do first? A. Slow the transfusion. B. Stop the transfusion. C. Notify the laboratory. D. Obtain a urine specimen. Answer. B. Stop the transfusion. Rationale. The most common Nclex trap is notifying others before stopping the source of harm. Question 9. A client has a serum potassium level of 2.8 milliequivalent/L. Which assessment finding requires immediate attention? A. Mild fatigue. B. Dry skin. C. Flattened T waves. D. Decreased appetite. Answer. C. Flattened T waves. Rationale. Cardiac electrical instability is the greatest risk associated with hypokalemia. Question 10. A nurse is caring for a client who suddenly becomes unresponsive and pulseless. What is the priority action? A. Notify the provider. B. Call family members. C. Initiate CPR. D. Complete documentation. Answer. C. Initiate CPR. Rationale. Nclex commonly tests immediate life-saving intervention before notification. Question 11. A nurse is preparing to administer digoxin to a client whose apical pulse is 54 per minute. What should the nurse do? A. Administer the medication. B. Hold the medication and assess further. C. Give half the dose. D. Recheck pulse after administration. Answer. B. Hold the medication and assess further. Rationale. Low apical pulse is a classic Nclex medication holding trap. Question 12. A client with diabetes becomes diaphoretic, shaky, and confused. What should the nurse do first? A. Obtain a blood glucose level. B. Notify the provider. C. Administer insulin. D. Document symptoms. Answer. A. Obtain a blood glucose level. Rationale. Verify suspected hypoglycemia before further interventions when possible and safe. Question 13. A client develops stridor immediately after medication administration. What is the priority action? A. Obtain vital signs. B. Assess airway. C. Document findings. D. Notify dietary services. Answer. B. Assess airway. Rationale. Stridor indicates possible airway obstruction. Question 14. A nurse notes absent bowel sounds 4 hours after abdominal surgery. Which action is appropriate? A. Notify the provider immediately. B. Recognize this may be expected. C. Prepare the client for emergency surgery. D. Administer laxatives. Answer. B. Recognize this may be expected. Rationale. Nclex often tests expected versus unexpected findings. Question 15. A client receiving heparin develops hematuria. What should the nurse do first? A. Assess the client. B. Increase fluid intake. C. Continue medication. D. Ignore the finding. Answer. A. Assess the client. Rationale. Assessment precedes intervention. Question 16. A client with COPD has oxygen saturation of 89% on baseline therapy, but is comfortable and alert. What is the best interpretation? A. This may be expected. B. Client requires intubation. C. Client is in respiratory arrest. D. Oxygen should be discontinued. Answer. A. This may be expected. Rationale. Nclex frequently tests expected COPD oxygen saturation levels. Question 17. A nurse observes another nurse preparing to administer medication from an unlabeled syringe. What should the nurse do? A. Ignore the situation. B. Intervene immediately. C. Wait until after administration. D. Document only. Answer. B. Intervene immediately. Rationale. Client safety overrides concerns about confrontation. Question 18. A client reports chest pain rated 9 out of 10. Which action is priority? A. Assess the client further. B. Obtain dietary history. C. Provide discharge paperwork. D. Measure weight. Answer. A. Assess the client further. Rationale. Assessment precedes intervention unless immediate life-saving action is required. Question 19. A nurse caring for multiple clients receives a critical laboratory value indicating potassium 6.8 milliequivalent/L. Which action is priority? A. Review ECG findings. B. Schedule physical therapy. C. Encourage ambulation. D. Offer a snack. Answer. A. Review ECG findings. Rationale. Hyperkalemia can cause life-threatening dysrhythmias. Question 20. A postoperative client suddenly becomes restless, anxious, and tachypneic. Which interpretation is most appropriate? A. Pain only. B. Possible hypoxia. C. Normal recovery. D. Sleep deprivation. Answer: B. Possible hypoxia. Rationale: restlessness is often an early sign of hypoxia, a frequently tested Nclex trap. Question 21. A charge nurse is assigning client care to a newly licensed RN, an experienced LPN/LVN, and an unlicensed assistive personnel, UAP. Which client should the charge nurse assign to the RN? A. A stable client requiring routine vital signs every 8 hours. B. A client scheduled for discharge teaching following a new diagnosis of heart failure. C. A client requiring assistance with bathing and grooming. D. A stable client needing a routine dressing change on a chronic wound. Answer: B. A client scheduled for discharge teaching following a new diagnosis of heart failure. Rationale: a common Nclex delegation trap is assigning teaching to the wrong team member. Initial teaching must be performed by the RN. Question 22. A nurse is caring for a client with severe gastrointestinal bleeding. The provider prescribes 2 units of packed red blood cells. Before initiating the transfusion, which action is most important? A. Warm the blood in a microwave. B. Verify the blood with another licensed nurse. C. Administer the blood as quickly as possible. D. Ask the UAP to obtain consent. Answer: B. Verify the blood with another licensed nurse. Rationale: identification errors are a major cause of transfusion reactions and are frequently tested on Nclex. Question 23. A nurse is caring for 4 clients. Which client should the nurse assess first? A. A client with chronic kidney disease whose potassium level is 5.8 milliequivalent/L and who reports palpitations. B. A client awaiting discharge instructions. C. A client requesting pain medication for pain rated 4 out of 10. D. A client who needs assistance ambulating to the bathroom. Answer: A. A client with chronic kidney disease whose potassium level is 5.8 milliequivalent/L and who reports palpitations. Rationale: the Nclex trap is focusing on requests instead of potential life-threatening dysrhythmias. Question 24. A nurse enters a client's room and discovers that the client's nasogastric tube has become dislodged. What should the nurse do first? A. Notify the provider. B. Reinsert the tube immediately. C. Assess the client. D. Complete documentation. Answer: C. Assess the client. Rationale: assessment is usually the first nursing action unless an immediate life-saving intervention is required. Question 25. A client with heart failure reports sudden shortness of breath. Assessment reveals crackles throughout both lung fields and frothy sputum. What is the priority nursing action? A. Obtain a daily weight. B. Place the client in high Fowler's position. C. Encourage oral fluids. D. Administer stool softeners. Answer: B. Place the client in high Fowler's position. Rationale: a classic Nclex trap is overlooking positioning interventions that improve oxygenation immediately. Question 26. A nurse receives report on 4 clients. Which client should be seen first? A. A client with pneumonia whose oxygen saturation decreased from 95% to 88%. B. A client requesting a blanket. C. A client awaiting breakfast. D. A client with chronic pain rated 3 out of 10. Answer: A. A client with pneumonia whose oxygen saturation decreased from 95% to 88%. Rationale: acute deterioration in oxygenation takes priority over comfort needs. Question 27. A nurse is reviewing laboratory values. Which finding requires immediate intervention? A. Hemoglobin 13.5 g/dl. B. Sodium 139 milliequivalent/L. C. Potassium 6.9 milliequivalent/L. D. White blood cell count 8,000/mm superscript 3. Answer: C. Potassium 6.9 milliequivalent/L. Rationale: severe hyperkalemia can rapidly cause fatal cardiac dysrhythmias. Question 28. A client receiving opioid analgesics becomes difficult to arouse and has a respiratory rate of 7 per minute. What should the nurse do first? A. Document findings. B. Stop the opioid and assess airway and breathing. C. Allow the client to rest. D. Notify dietary services. Answer. B. Stop the opioid and assess airway and breathing. Rationale. The Nclex often tests recognition of opioid-induced respiratory depression. Question 29. A nurse is caring for a client with suspected pulmonary embolism. Which assessment finding is most concerning? A. Mild nausea. B. Sudden chest pain and dyspnea. C. Poor appetite. D. Fatigue after walking. Answer. B. Sudden chest pain and dyspnea. Rationale. Sudden respiratory compromise may indicate a life-threatening pulmonary embolism. Question 30. A nurse is evaluating a postoperative client 24 hours after surgery. Which finding requires immediate follow-up? A. Pain rating of 4 out of 10. B. Temperature of 37.2 degrees Celsius, 99 degrees Fahrenheit. C. New onset confusion and restlessness. D. Mild incisional tenderness. Answer. C. New onset confusion and restlessness. Rationale. Confusion and restlessness may be early signs of hypoxia, sepsis, or neurological compromise. Question 31. A nurse is caring for a client receiving 4 potassium replacement. Which findings require immediate action? Select all that apply. A. Burning at the force site. B. Heart rate 48 per minute. C. Peak T waves. D. Potassium level 4.2 milliequivalent/L. E. New muscle weakness. F. Clear lung sounds. Answer. A. Burning at the force site. B. Heart rate 48 per minute. C. Peak T waves. E. New muscle weakness. Rationale. Potassium administration complications and cardiac abnormalities require immediate attention. Question 32. A charge nurse is assigning tasks. Which task is appropriate to delegate to the UAP? A. Assessing a newly admitted client. B. Teaching a client about insulin administration. C. Assisting a stable client with feeding. D. Evaluating pain medication effectiveness. Answer. C. Assisting a stable client with feeding. Rationale. UAPs can perform routine, non-assessment, non-teaching tasks. Question 33. A client develops sudden facial swelling, wheezing, and difficulty breathing after receiving an antibiotic. What should the nurse do first? A. Complete documentation. B. Assess airway and prepare emergency interventions. C. Obtain a dietary history. D. Recheck the medication order. Answer. B. Assess airway and prepare emergency interventions. Rationale. Airway always takes priority during anaphylaxis. Question 34. A nurse is caring for 4 clients. Which client can be assigned to the LPN/LVN? A. A client requiring admission assessment. B. A client requiring discharge education. C. A stable client needing routine medication administration. D. A client with sudden chest pain. Answer. C. A stable client needing routine medication administration. Rationale. Stable clients with predictable outcomes are appropriate assignments for the LPN/LVN. Question 35. A client with diabetes reports shakiness, diaphoresis, and blurred vision. What is the nurse's priority action? A. Check blood glucose level. B. Administer long-acting insulin. C. Encourage exercise. D. Document symptoms. Answer. A. Check blood glucose level. Rationale. Symptoms suggest hypoglycemia, which must be assessed promptly. Question 36. A nurse caring for a client with heart failure notes increasing crackles, worsening dyspnea, and oxygen saturation dropping from 95% to 87%. Which action is priority? A. Encourage fluid intake. B. Apply oxygen. C. Provide dietary education. D. Measure abdominal girth. Answer. B. Apply oxygen. Rationale. Oxygenation takes priority over all other interventions. Question 37. A nurse reviews a provider prescription that reads, morphine sulfate 10 milligrams for every hour PRN pain. The client is opioid naive and weighs 45 kilograms. What should the nurse do? A. Administer the medication. B. Clarify the prescription. C. Ask the UAP to monitor the client. D. Give half the prescribed dose. Answer. B. Clarify the prescription. Rationale: Nclex frequently tests unsafe prescriptions that require clarification before administration. Question 38. A client with a tracheostomy suddenly becomes restless and oxygen saturation drops to 82%. What should the nurse do first? A. Assess airway patency. B. Notify the provider. C. Document findings. D. Administer pain medication. Answer: A. Assess airway patency. Rationale: airway problems are the most immediate threat. Question 39. A nurse receives a critical laboratory result indicating blood glucose of 42 milligrams per deciliter. The client is awake and able to swallow. Which action is most appropriate? A. Provide a rapid-acting carbohydrate. B. Administer insulin. C. Restrict oral intake. D. Notify dietary services. Answer: A. Provide a rapid-acting carbohydrate. Rationale: immediate treatment of symptomatic hypoglycemia is the priority. Question 40. A postoperative client suddenly reports calf pain, warmth, and swelling. What is the nurse's priority action? A. Massage the affected leg. B. Assess for possible deep vein thrombosis. C. Encourage ambulation. D. Apply heat vigorously. Answer: B. Assess for possible deep vein thrombosis. Rationale: a common Nclex trap is choosing interventions that could dislodge a clot. Question 41. A nurse is caring for 4 clients at the beginning of the shift. Which client should the nurse assess first? A. A client with a fractured femur reporting pain rated 8 out of 10 despite prescribed analgesics. B. A client with chronic heart failure who gained 2 pounds, 0.9 kilograms, overnight. C. A client admitted with pneumonia whose oxygen saturation has decreased from 94% to 86% despite oxygen therapy. D. A client scheduled for discharge who has questions about medications. Answer: C. A client admitted with pneumonia whose oxygen saturation has decreased from 94% to 86% despite oxygen therapy. Rationale: one of the biggest Nclex traps is choosing pain or discharge concerns over worsening oxygenation. Airway and breathing take priority. Question 42. A nurse is caring for a client receiving a continuous heparin infusion. Which findings require immediate follow-up? Select all that apply. A. Blood and urine. B. Black, tarry stools. C. Activated partial thromboplastin time, APTT, above therapeutic range. D. Platelet count of 35,000/mm superscript 3. E. Small bruise at an old venipuncture site. F. New onset headache. Answer: A. Blood and urine. B. Black, tarry stools. C. Activated partial thromboplastin time, APTT, above therapeutic range. D. Platelet count of 35,000/mm superscript 3. F. New onset headache. Rationale: these findings may indicate significant bleeding or heparin-induced thrombocytopenia. The Nclex trap is minimizing signs of internal bleeding. Question 43. A nurse receives report on 4 clients. Which client should be seen first? A. A client with chronic kidney disease whose potassium level increased from 4.8 to 6.7 milliequivalent/L and is reporting palpitations. B. A client requesting assistance with bathing. C. A client awaiting routine wound care. D. A client requesting discharge paperwork. Answer: A. A client with chronic kidney disease whose potassium level increased from 4.8 to 6.7 milliequivalent/L and is reporting palpitations. Rationale: hyperkalemia with cardiac symptoms can rapidly become fatal. Question 44. A nurse is reviewing provider prescriptions for a newly admitted client. Which prescription should the nurse question immediately? A. Acetaminophen 650 mg PO every 6 hours PRN fever. B. Potassium chloride 20 milliequivalent diluted in 4 fluid over several hours. C. Morphine 2 mg 4 every 4 hours PRN pain. D. Potassium chloride 20 milliequivalent 4 push stat. Answer: D. Potassium chloride 20 milliequivalent 4 push stat. Rationale: potassium 4 push is never administered because it can cause fatal dysrhythmias. Question 45. A client suddenly becomes unresponsive. The nurse enters the room and notes the client is not breathing normally. What should the nurse do first? A. Check for a pulse and begin emergency response procedures. B. Notify the provider. C. Review laboratory results. D. Obtain a blood pressure. Answer. A. Check for a pulse and begin emergency response procedures. Rationale: a frequent Nclex trap is delaying emergency interventions to gather additional information. Question 46. A nurse is caring for a client with sepsis. Which findings require immediate intervention? Select all that apply. A. Blood pressure 82/46 mm of mercury. B. Urine output 15 milliliters per hour. C. Lactate level elevated above normal. D. New confusion. E. Warm skin. F. Oxygen saturation 88%. Answer. A. Blood pressure 82/46 mm of mercury. B. Urine output 15 milliliters per hour. C. Lactate level elevated above normal. D. New confusion. F. Oxygen saturation 88%. Rationale: these findings indicate worsening organ hypoperfusion and possible septic shock. Question 47. A nurse is caring for a postoperative client who suddenly develops shortness of breath, tachycardia, anxiety, and chest pain. What is the priority nursing action? A. Place the client in a flat position. B. Assess oxygenation and apply oxygen as needed. C. Encourage the client to ambulate. D. Obtain a dietary history. Answer. B. Assess oxygenation and apply oxygen as needed. Rationale: the client may be experiencing a pulmonary embolism. Airway and oxygenation are the priorities. Question 48. A charge nurse is making assignments. Which client is most appropriate for the experienced LPN/LVN? A. A client admitted 15 minutes ago with chest pain. B. A client requiring initial education after a new colostomy. C. A stable postoperative client requiring routine medication administration and dressing changes. D. A client with worsening respiratory distress. Answer. C. A stable postoperative client requiring routine medication administration and dressing changes. Rationale: Nclex delegation questions often test recognition of stable versus unstable clients. Question 49. A nurse is caring for a client with diabetic ketoacidosis, DKA. Which findings indicate improvement? Select all that apply. A. Blood glucose decreasing toward target range. B. Serum bicarbonate increasing toward normal. C. Mental status improving. D. Urine output improving. E. Persistent Kussmaul respirations. F. Closing anion gap. Answer. A. Blood glucose decreasing toward target range. B. Serum bicarbonate increasing toward normal. C. Mental status improving. D. Urine output improving. F. Closing anion gap. Rationale: improvement in metabolic status, hydration, and acid-base balance indicates effective treatment. Persistent Kussmaul respirations suggest ongoing acidosis. Question 50. A nurse is caring for a client whose condition suddenly deteriorates. The client is restless, confused, tachypneic, hypotensive, and has oxygen saturation of 84%. Which nursing principle best guides prioritization? A. Address pain before physiologic needs. B. Complete documentation before interventions. C. Prioritize airway, breathing, and circulation. D. Notify the provider before assessing the client. Answer. C. Prioritize airway, breathing, and circulation. Rationale: the most common Nclex mistake is becoming distracted by secondary concerns. When a client is deteriorating, ABCs, airway, breathing, circulation, remain the foundational priority framework. Mastering Nclex is not just about memorizing facts. It is about avoiding the traps that lead to wrong answers. Always identify the unstable client. Prioritize airway, breathing, and circulation. Assess before acting when appropriate. And remember that the safest answer is often the correct answer. The more traps you recognize, the more confident and successful you will become on exam day and in clinical practice.